can I thank the people of Greater Sydney, especially those in those local government areas of concern in and around Fairfield and Canterbury-Bankstown for coming out and getting tested. We hit another record of 85,000 tests, which means in the last 2 days alone, we've had around 170,000 people get tested. As a result, unfortunately, case numbers have gone up again, 124 cases of community transmission, and unfortunately, 48 of those were infectious in the community. Now, given that number of infectious in the community, I'm expecting case numbers to go up even higher. It's really, really important to continue those high rates of testing because, as Dr Chant said earlier this week and towards the end of last week, it's really important for us to scoop up all the possible cases that are out there. And we're also finding cases when we're testing workers during that 3 days of required testing. So it's extremely positive that 85,000 people have come forward to get tested. It's a new record in New South Wales. But regrettably, what that has done is uncover more positive results and uncover a very high rate of results, at least 48 who are infectious during that time in the community. There's no doubt, again, that we anticipate case numbers will continue to go up before they start coming down, and we need to brace ourselves for that. And as Dr McAnulty will report today, it does mean more presentations to hospital. I also want to say that, unfortunately, our fears of having spillover from the Fairfield local government area and all the suburbs in that local government area into the Canterbury-Bankstown local government area and into the Cumberland local government area have proven to be materialising or proven to be occurring. So we're asking for people in those communities to be alert and come forward for testing, and Dr McAnulty will read out the suburbs in particular where we do want people to come forward and get tested. Unfortunately, we're finding the two main areas of transmission again, or the two main places where people are getting the virus or spreading the virus, continue to be in workplaces and also in households. Unfortunately, when our health experts are interviewing families within households, we're learning that they have visited families in other households and the disease is spreading through that way, but unfortunately also in workplaces. We're finding that when people are going to buy their groceries or when people are going to the pharmacist or other critical retail or other critical workplaces, that unfortunately the disease is spreading. And recent cases have demonstrated it's not just between workers, which it was before, but we're also noticing now workers and patrons are picking up the disease, taking it home to their families. And unfortunately, if your household chooses to visit another household, which you shouldn't be doing, that virus is then spreading to the additional household. And I can't stress enough how distressing it is for us when we uncover entire families who've got the virus, who've unknowingly or unwittingly given it to their extended family members, households on households of loved ones, just from one worker or one person bringing it home to the rest of their families. The strongest message we can give everybody at this time is please stay at home. Please only leave your home when you absolutely have to. We can't stress that enough. And we can't stress enough how contagious, it's cruel the way this virus is contagious. Any human contact means you can pick up the virus or give the virus. It is spreading like we've never seen before. And I especially want to thank our contact tracers, because if it was not for their efforts, the 124 case numbers today would literally have been in their thousands, and I don't say that lightly. I really want to thank the contact tracing team who've been working 24/7 unbelievably, and sometimes they've had to go back and re-interview people. People remember things subsequently, so please watch out for all those venues of concern. Sometimes close contacts tell us a few days after they've been notified that they remember being in a particular place. So please know those venues of concern are often updated and for good cause. I just want to thank in particular today our frontline health workers, our contact tracers, who've done an unbelievable job, because their efforts have meant that we have, whilst the case numbers are very concerning, they're nowhere near what they would have been, and that should give us heart. But what needs to give us more heart is seeing a change in those number of people infectious in the community. Please just don't take the risk. We're seeing more and more people without symptoms carry the virus and spread it, and we just can't have that continue. So thank you to everybody who's come forward and got tested. That is very positive, and I want to encourage that, obviously, whilst we're in this very dangerous period. But I also say to everybody, please do not assume do not assume that anybody you are in contact with, you should assume, I should say, that anybody you're in contact with has the virus, or anybody you're in contact with can get the virus. And please know the last thing we want for anybody is hearing those sad stories of people taking it home and passing it on to the people they love the most. Again, I want to thank everybody for their efforts. And finally, my message for today, as Dr McAnulty will reinforce, please get vaccinated. The vaccine is key to our freedom. The more people we have vaccinated, the quicker we can live life as freely as we would like. Please know that if you're over 60, obviously, AstraZeneca is available. If you're over 40, New South Wales Health can provide you with AstraZeneca. But even if you're under 40 and you really want to get the vaccine, please ask your GP. Your GP may give you the green light, and people of any age can get the vaccine. Please come forward and get vaccinated. It's so important. It's critical for us to have as much of our population vaccinated as quickly as we can. And the other one bit of positive news is, as I understand it, there is nobody currently in intensive care who's had 2 doses of the vaccine. So we know the vaccine prevents serious illness. There is currently nobody in intensive care who's had both doses of the vaccine of any age, and that is extremely encouraging. It means the vaccine is working in preventing serious illness, and we really need people to remember that and to feel confident when they're getting vaccinated.